Alright YouTube, this is Kitty Clinical here with another video. I've got a short one for you today. This one's going to be on Step 3, CCS. Those cases at the end. You know, you go take the exam, it's 2 days long. Day one is like a big, slap in the face. You've got biostats, you've got Step 1. Day 2, you're looking at Step 2 stuff, a little bit of clinical knowledge. And then the second half, you've got a ton of these CCS cases. So I'm not going to go into detail about CCS cases. That'll be a separate video. But for those of you who already know what CCS cases are, and I'm sure there's a lot of you out there, we're going to go through 3 pearls of wisdom. And they're very, very easy, very, very basic gems that I think everybody would benefit from. And they're pretty obvious, but they're worth mentioning and they're worth having a video about. So, practice makes perfect. Practice, practice, practice. Please do yourself the favor and practice. There's UWorld CCS cases. There's ccscases.com. There's Crush USMLE CCS cases, the book, the app. You can download the app for about the same cost as the book itself. And you just got to do cases. Seriously, the reason why people fail Step 3 a lot of times is because they didn't practice the CCS cases. They did really well on multiple choice, the MCQs, but they didn't practice the cases because they thought they could get away with it. Well, medicine does not work like that. Medicine is cold-blooded, okay? You got to practice. It goes back to that whole book smart versus hardworking dilemma. Like you gotta work hard. You gotta do a case every single day if you can. Okay, so let's say you're studying a year out, and you're gonna take your exam in 365 days. Well, guess what? If you can do a case a day, let's say you take a day. Let's say like Friday is your chill day, or Friday night into Saturday morning, you sleep in. Okay, so out of 6 days, I don't know what 6 out of 7 times 365 is, but there's a lot of days out there. If you do one case, one simulation, one practice case a day, the returns will be very, very huge. Okay, you will benefit from them a lot. Yes, maybe you don't remember the case from 50 days ago, but you did it, and you'll remember it. Maybe you won't remember that specific case on how to manage diverticulitis, okay? But you've done so many of these cases that you know that you got to give the patient antibiotics, you got to do pain control, maybe you want to consider GI consult or general surgery consult if it's like, appendicitis, or, you got to think about these common cases, bread and butter. But you got to practice first, okay? Practice makes perfect. So that's going to be gem number 1. Gem number 2, location, location, location. I know real estate talks about this. I know they talk about the 3 words in a lot of stuff. The economy, everything. But location, location, location is also very important and crucial in CCS cases. Where are you right now? Are you in the office? Is this patient stable or not stable? Are they stable enough to stay in the office, or do they need to go to the emergency room? If they need to go to the emergency room, send them there. Don't wait. And honestly, this is true of anything, really. Not just CCS cases, but if you're in clinic and you see a bunch of patients and one of those patients is short of breath, maybe they got a blood pressure of 80/40, maybe they're hypothermic, you got to send them to the emergency room. You cannot manage them in the outpatient setting. So keep that in mind. Location is everything. And also, do they meet criteria for the ICU, or do they just need to go to the floors? I don't think there's a distinction between observation and full admission when it comes to the CCS cases. But there is a difference between inpatient unit and ICU, or intensive care unit. So try to think to yourself, when would be a good time to put this patient in the hospital versus in the ED versus in the ICU? Well, there's a few things that you might think to yourself. The most obvious thing is, well, what can you do in the hospital that you can't do in the office, right? Well, there's a few things that you can do in the hospital that you can't do in the office. IV fluids, IV antibiotics, okay? If they have osteomyelitis, they might need IV antibiotics. If they're seriously dehydrated to the point where you need to give them IV fluids, send them to the ED and they'll get IV fluids there. Maybe they don't need to be admitted. Maybe after an hour of normal saline, they'll feel better and they can just go home. But send them to the ED. Send them where it's appropriate to do all these things. Nasal cannula. That's nasal cannula is like an inpatient floor thing. You can also do nasal cannula in the ED, I guess. But if they need to be on long-term oxygen, let's say they have worsening COPD exacerbation, they're a heavy smoker, they got 50-pack year smoking history, then you gotta consider the fact that they might need to stay in the hospital for at least a couple nights until we get their oxygen better controlled, until social work and case management sets them up for home oxygen therapy. That all takes time. And this is not something that's specific to the CCS cases. I'm talking in general about location here. So we can go more into detail about location, but I think that I've honed in on the point and I've kind of really put that to good use. Okay, step number 3, or gem number 3 is breathe. Please remember to breathe. So many people choke on this exam because they freaking out. They're not sure what to do. And when you don't know what to do and you're freaking out, there's this thing called the cortisol effect. Cortisol or cortisone, whatever, stress hormone in your body, it shuts down your thinking. It activates parts of your brain, deactivates certain parts of them. Your entire physiology is just different when you're under stress. Okay, so try to breathe. Take 10 seconds to take a deep breath, and then get back into the. I know it's timed. I know that you don't have a lot of time. I know you have to put in orders. I know that the computer is glitched. I know that the program is slow, but you have to do your due diligence and be mindful of your own well-being. So make sure that you can breathe. Make sure that you are able to concentrate. And this is not just advice for step 3. This is also advice for being a doctor. Because when you're a doctor, you need to be able to breathe. Okay? If you're going to a rapid response, you should not be the rapid response. Okay? You need to relax and chill out and just kind of think critically about the patient. What do you need to do to get this patient to where they need to go? Don't forget to manage their pain. Okay, don't forget to, if they need Tylenol, give them Tylenol. Okay, don't forget to, if they're short of breath, don't forget to give them oxygen. Maybe they're asthmatic, maybe they need albuterol or a nebulizer treatment. Don't forget all that stuff. Okay, and we'll go into more detail with more CCS cases, gems or pearls of wisdom, but these are the top 3 in my book that I want to mention first, because I think they're the 3 probably the most important ones and the most obvious ones, but they're not ones that you should forget about. So any questions, don't be afraid to message me or comment down below. See you later, folks.